Hi, this is Dr. Kirk Lozada. I'm a facial plastic surgeon and rhinoplasty specialist at Penn Medicine Becker ENT, and this is 2-Minute Consults. When discussing brow lift surgery, it's important to understand what happens to the eyebrows as we age. There's two components to the eyebrows. There's the inner part and the outer part of the eyebrow. Over time as we age, these things can both fall. And when they fall, they tend to give a very heavy and a very tired appearance. It can even make certain people look very angry. And this is something that people don't like being commented on, and they come in and they talk about, people notice that I feel very tired or very heavy, very angry, and I want to kind of do something about that. What can I do? And so brow lift surgery can really alleviate these feelings and these looks and appearances to certain patients. A good candidate for a brow lift surgery is someone who is complaining of feeling very heavy or very tired appearing to their upper eyes. And then as well as when I look at their eyebrow shape, I can tell that it's fallen below the level of this bony rim up here. And if I can see that, then I know by lifting that eyebrow up into a higher position, we can usually rejuvenate that whole area and make them look much more awake and much more refreshed. Brow lift surgery has a long history and many different approaches. One of the original brow lift surgeries involved a very large incision that came from about your ear through the scalp all the way to the other side. It's not something that's typically done these days as frequently, and so we have much more minimally invasive ways to target the brows and lift them into a much more natural position. Some of the more typical things that we do and that you'll see when looking up these procedures is one called a trichophytic lift, so you can actually make an incision either within the hairline here to get down to where the eyebrow is to lift it up in a more natural position. Some of the other ways are something called an endoscopic brow lift, where we actually use little tiny cameras, as well as simply treating certain parts of the brow, whether we're just bringing up the tail of the eyebrow.